Here with us today is Chris Cosmore, Director of Cardiac and Pulmonary Rehab and Community Outreach here at Shore Memorial Hospital, here with us to tell us more about managing cardiac risk factors. What are some risk factors that increase your chances for heart attack and stroke?
Heart disease and stroke are very much similar. One affects the heart muscle and the other affects the brain. So we look at some of the risk factors really applying to both, which really helps an individual to understand why they could possibly have a heart attack or stroke. The hardening of the arteries, or the plaque formation that forms in the coronary arteries, is what lacks the oxygenated blood to get to the either heart muscle or to the brain. So some of those risk factors, a big one is smoking. People do not need to smoke. Smoking is a very large, big changeable risk factor. High-fat diets, lack of activity, family history. We can't change family history, but we certainly could do something to modify it. These are the risk factors that we can look toward to help modify or change.
So besides lifestyle changes like stop smoking and watching your diet, are there any risk factors that can be modified by medications?
Oh, absolutely. We know that if an individual has high blood pressure and it can't be changed by diet and exercise and lowering their body weight, because sometimes that'll drive blood pressure up. Yes, there are medications that are very tolerable today. There are many of them that help people to get their blood pressures down because that's what we need. We know high blood pressure is known as a silent killer. That's why people that have hypertension, high blood pressure, can have stroke or have a heart attack. They can be modified. They need to have their blood pressure checked regularly. If not with their doctor, go to a screening. Go to the local drugstore or the supermarket. They can check their blood pressure there.
You mentioned blood pressure being known as the silent killer. Why is that?
Because you don't feel it. You don't know when your blood pressure is going up. There are individuals who will say, oh, I have a headache, I feel pressure in my head. That may be other causes, but certainly if they feel that, they should have their blood pressure checked immediately. But many times they feel nothing. So therefore, when they have a stroke or a heart attack and they're then evaluated, so well, your blood pressure is extremely high. How long have you had high blood pressure? And they'll say, well, I never knew I had high blood pressure. So these are the things, especially if you have a strong family history of heart disease or stroke, you should be checked at a relatively early age, in their 20s, in your 30s. Don't wait till you get into your 50s and 60s, then have hypertension that's already caused major damages and it's hard to reverse.
Are there any other symptoms of high blood pressure besides headache that we hear so much about?
Sometimes, fatigue can come on when your blood pressure is too high. You can shortness of breath, but they're not really terribly associated with just high blood pressure. Generally, you do not feel symptoms from your blood pressure going up. That's the hard part about it. But I'm always cautioning everyone, our patients, people in the community, just to know what your numbers are. Check and see if, in fact, you have high blood pressure. Blood pressure never stays constant. It could be one number one moment and different the next. Obviously, activity increases your blood pressure, but that's a good way for blood pressure to go up. It's your numbers at rest, when you're sitting doing nothing, that we really, truly want to evaluate.
So medication, exercise, diet change, these are all ways that some people can lower their blood pressure?
Oh, absolutely. When it comes to the diet, foods that are lower in salt, sodium, because we know that salt and sodium in your diet tends to hold fluid in. Excess of fluid circulating in your bloodstream makes the heart work harder, and then blood pressure goes up. So we definitely want to make sure that you're watching your foods, not just things that are high in calorie, but also high in salt.
Thanks, Chris, so much for being with us today. For more information, please visit shorehealthtoday.com. I'm Kim Hansen from Shore Memorial Hospital for Health Today.